to continue their education and training here. And that's about to change. Iowa Health and Human Services, under the leadership of Director Garcia, there she is over there, and in partnership with the University of Iowa and Broadlawns, will increase Iowa's residency capacity, creating an estimated 115 additional slots annually. And that'll be for medical residents across our 14 teaching hospitals, and it will also help fund startup costs for new residency programs and specialties. Just 3 to 4 years from now, the amount of time that it takes for a typical residency rotation, we could have up to 460 more physicians being trained right here in Iowa, with some ready to enter the workforce. And we're going to be ready for them. Loan repayment is another important part of total compensation when a hospital or medical practice is recruiting new physicians, especially to rural areas. For that reason, the bill consolidates Iowa's 5 state-funded health care loan repayment programs into one, nearly doubles the funding to $8 million, and prioritizes based on high-demand specialties and positions. These strategic investments will not only strengthen Iowa's healthcare system, I believe they'll make Iowa the place where physicians want to learn, where they want to train, and where they want to practice. Of course, doctors rely on a strong team to work with them. And our $3 million healthcare credentialing grant program enables hospitals and other providers to educate, train, and upskill the next generation of healthcare professionals, really giving them the flexibility to custom build their pipeline with the most in-demand positions. Later this afternoon, we're going to release we'll have a press release that will go out, and it will announce the winners of the Healthcare Credentialing Grant Program. We had 14 programs that were awarded, and that will be 399 participants that will be involved in career pathways to a CNA, LPNs, RNs, or CMAs. And the good news is that really does build on the Healthcare Registered Apprenticeship Program that we released, I think, a year and a half ago, where we awarded 23 programs with significant funding, which to date has 394 active apprentices taking part in that. So that's 394 in the Registered Apprenticeship Program, and with the new credentialing grant program that will drop this afternoon, that'll add another 399. So we really are starting to build out that workforce. The bill also further stabilizes and strengthens maternal health services, including labor and delivery, by unbundling Medicaid rates and increasing reimbursement for medically complex pregnancies and births. And finally, the bill also creates efficiencies by consolidating the functions of the Healthcare Facilities Council, turning the Certificate of Need process over to Health and Human Services, where a new on-staff health economist will inform important decisions on the approval and construction of medical facilities. It also gives Health and Human Services the authority to competitively procure and manage the health information system. So these improvements will empower us to operate more efficiently and more effectively on behalf of Iowa taxpayers, and most importantly, support a high-performing health system that provides high-quality care for Iowans. So while I can tell you the many benefits of this legislation and what it has to offer, Chris is better positioned to really talk about the difference that it'll make here at this hospital, and most importantly for its patients and community. Chris?
Thank you, Governor. Good afternoon. On behalf of the Guthrie County Hospital Board, medical staff, and employees, I'd like to welcome all of you to Guthrie County Hospital. Today, we're fortunate to welcome the governor of our great state to sign a pair of bills that strengthen healthcare in Iowa. These bills offer a number of positive changes, but 2 intentional pieces are apparent when you look at these bills. Number 1, our ability to protect the safety of Iowa's healthcare workforce is paramount. And 2, sustaining our ability to recruit and retain healthcare workers in rural Iowa is a priority of this administration. Workforce shortages are one of our biggest challenges in rural healthcare, and since the pandemic, shortages have grown only more severe. I think we can all agree if healthcare workers do not feel safe at work, it makes it even more difficult to recruit and retain talented healthcare workers to rural hospitals, really in all our hospitals in Iowa. Governor, on behalf of Iowa's hospitals and their employees and our patients, thank you to you and the legislature for standing up for all our healthcare workers and volunteers. Equally important to making our dedicated staff feel safe at work is successfully recruiting physicians and other healthcare providers to work in rural Iowa. It's no secret there's a physician shortage and a nurse shortage. But let's be honest, there's a shortage of all qualified healthcare workers in nearly every field. And workforce shortages are often more severe in smaller communities. If we are to continue to effectively care for our rural Iowa communities, critical strategies such as loan forgiveness programs and graduate medical education programs must be funded and expanded and run efficiently. Again, thank you to Governor Reynolds and to the legislature, especially our friend Carter, who's going to speak here in just a moment, for recognizing the importance of loan forgiveness programs for healthcare workers and the value of supporting graduate medical education in our state. Let's show our appreciation again. And finally, Governor, we appreciate you being here in person to sign these bills and to show your support for our hospital and all of Iowa's rural hospitals. Keep up the good work, and thank you so much.
Thank you, Chris. I'm so grateful to you and your team and to all the employees who are caring for patients and operating this facility. We just appreciate you. And rural Iowa is a priority of this administration, and so we're going to keep doing everything we can to build out prosperity in every single corner of the state, and that starts with a really viable hospital and health care, so we know that that's really important. You know, it takes a team, and I want to thank yours for everything that they do to improve the health of this community, but it also takes a team to create important legislation like this bill and then shepherd it through the process. And I want to thank my team, including Director Garcia from Health and Human Services and Director Snow from the Department of Education, who were absolutely critical in developing this legislation and who will be responsible for its implementation. And really, Kelly traveled the state and held a lot of meetings with healthcare providers and took a lot of intake and a lot of input, and this really is a result of what she heard getting out in the state, sitting down with healthcare professionals, administrators at the hospitals, and together we were able to come up with a bill that I think really accomplished what we set out to do. So thank you for that. I really appreciate it. A special thank you also to Health and Human Service Committee chairs, Senator Klemish and Representative Nordman, who managed the bill throughout the legislative process. And I'd like to invite Representative Nordman to say a few words. Pardon?
Well, thank you, Governor. Just looking out in the crowd here, if you're an elected official, could you stand up? I want to make sure that you're recognized as well. If you're an elected official, please stand up. Let's give them a round of applause. They do so much for our community, and I also just want to shout out Senator Green for being a great partner in the Senate as well. I want to begin by expressing my heartfelt gratitude to Governor Reynolds for her unwavering leadership and commitment to improving health care access for all Iowans, especially those in our rural communities. Governor, your vision and dedication have made today's signing of House File 972 possible, and for that we are deeply grateful. I also want to extend a thank you to Guthrie County Hospital for hosting us. Your facility and staff are great examples of the exceptional care provided to rural Iowans, and it's an honor to celebrate these accomplishments here with you today. To all the doctors, nurses, and healthcare professionals across Iowa who work tirelessly every day to deliver world-class care, often under challenging circumstances, thank you. Your compassion, expertise, and dedication make a profound difference in countless lives in Iowa. As the chair of the Health and Human Services Committee in the House and the floor manager of House File 972, I am excited to have the governor here in District 47 to sign this important legislation. I believe that House File 972 is a transformative step forward in rural health care. This bill strengthens Iowa's healthcare system by significantly increasing residency slots in our teaching hospitals, ensuring more physicians are trained and encouraged to practice here in Iowa. It consolidates and streamlines our rural healthcare loan repayment program while targeting high-need areas across the medical field. And it takes a major step forward in moving towards a hub-and-spoke funding model to establish regional collaboration between healthcare providers in rural areas. Together, these measures build on Iowa's strong foundation to ensure quality health care reaches every corner of our state. As the governor signs House File 972 into law today, we celebrate a bright future for rural health care in Iowa, a future where every family has access to care they need when they need it. Additionally, I am also excited to see House File 310 signed into law today, a vital step forward in protecting our health care workers. This bill expands the definition of health care providers under the enhanced penalties for assault within the Health Care Code. Every health care worker, no matter their role, deserves to be safe from violence while serving our communities. And lastly, I want to thank you, Governor, again, for your leadership and deep care for rural Iowa. I'm excited to continue our work on these issues and excited to see these bills signed into law today. Thank you.
Well, thank you, Carter. And, you know, he embraced the opportunity to lead this important committee, and it is a hard committee, and you stepped up, and I just appreciate all your work. I appreciate your support that you did on that, and really appreciate your service to Iowans. And I want you all to know, I don't think that it hardly passed both chambers. I think you were one of the first legislators that we had reach out to Molly to say, I want that signed here. So he was right on, Johnny on the spot to make the request to come here to sign this really important, these two important bills into law. As you heard, in addition to the rural health care bill, I'm also going to sign House File 310, and that's a bill that protects healthcare employees and volunteers from workplace violence, which expands upon previous legislation that protected patient care employees. Unfortunately, violence has become more common in healthcare environments, and it can affect any employee. And to keep our communities healthy, we also protect the people who make it possible. So again, I want to thank Senator Green for joining us today as well. Thank you again for hosting us here. We really, really appreciate it, appreciate the services that you provide your community and surrounding communities. And I want to thank the floor managers for the second bill. It was Senator Webster, Representative Meyer, for their work on that bill as well. And I think we need to give a big round of applause for the healthcare workers that are over here against the wall for all that you do. Woo! Our goal is to send you some help and recruits, so thank you for what you do. We appreciate it very much. And with that, you want to come on over and we'll come on up? Anybody else want to come up? That's House File 972. So if you haven't been to a bill signing before, the reason that I'm using so many pens and it looks like my 4-year-old granddaughter signed my name is because it kind of would give the people that are up here a pen that I actually use signing the bill. So it's getting kind of Okay, you had a little bit to do with
I
this.
want to give one to Dex.
Just right there. Thank you so much. Thank you. Did I get you one?
Yes, I have one.
Thank you, everybody, for being a part of today's ceremony.
That concludes the bill signing ceremony. We're going to take the governor on a quick tour around the hospital, so you're welcome to visit, or this event's over. Thank you. Yeah, thanks for coming. Sue wants to catch you before.
Yes, yeah. I'm going to take Matt on this tour.
That's fine.
We won't,
Tell her she can stick around.
yeah, we'll only be like 15 minutes.
She stays, we'll be around. How are you doing? Good? Yeah.